Good morning, everyone, and welcome to the African Swine Fever Packer Exercise Series Communications webinar. The Veterinary Services National Training Exercise Program is excited to host this third webinar in our series preparing planners, players, and observers for our African Swine Fever Packer Policy Workshop on January 11th to the 13th, 2021. These webinars will also be posted on our TEP video gallery to support awareness for the broader FAD response community. And now I'd like to introduce our speakers for today. Michael Krusen is the Communications Director at the Minnesota Board of Animal Health. He joined the agency in December 2015, and prior to this role, he worked in communications at the Department of Agriculture. His career began in television news with various roles in the studio and out in the field, including a story with a two-nosed cow named Lucy. He oversees the board's communications campaigns, media relations, program outreach, and manages internal and external communication channels. Our second speaker today will be Michael Stepien, and he's worked for the USDA for 4 years as a public affairs specialist and currently supports the Animal and Plant Health Inspection Service, Veterinary Services, which is responsible for protecting and improving the health, quality, and marketability of the U.S. agricultural animals, animal products, and veterinary biologics. Prior to joining APHIS, he worked for USDA Rural Development, where he was responsible for all public affairs activities, first in Kentucky and then in North Dakota. He was a Department of Defense civilian employee for 8 years and deployed to multiple countries, including temporary duty as the public affairs specialist on a battalion command staff in Afghanistan. He's a graduate of the University of Louisville and an Army veteran. Our final speaker today will be Jackie Matson, who joined the National Pork Board in December 2019 to lead communication efforts for the Pork Checkoff, a commodity marketing program funded by America's 60,000-plus pig farmers. In this role, she is responsible for reaching consumers with information about how pork is raised and pig farmers with resources to help them improve their operations. Jackie has nearly 2 decades of experience conducting effective communication programs for the agricultural industry. She represented agribusiness clients while at the Kansas City office of global PR firm Fleischman Hillard and oversaw global public affairs for DuPont Pioneer, now Corteva AgriScience. Jackie also spent 10 years as the National Cattlemen's Beef Association in Denver, where she led the organization's Beef Checkoff-funded issues and reputation management program. And with that, I will turn it over to our first speaker, Michael Krusen.
Good morning, Barb. Can you hear me?
I can.
Okay, excellent. As mentioned, I am Michael Krusen. I'm with the Minnesota Board of Animal Health, and today what I'll be focusing on talking about is where we come into the grand picture of communicating with an animal disease emergency and how those steps kind of play out. So to begin with, I'd like to start by saying that when a foreign animal disease is confirmed, it's only going to be reported by the USDA. So please keep that in mind, that me talking about everything in my presentation at the state level, it's all pre-USDA confirmation. So all that we're doing is going to be internal, kind of private level communications. We're not letting anything out to the general public at this point because it's very important to leave that to the USDA to make that official disease confirmation, which my other co-speaker here will talk about later on in the presentation about the importance of that. So with the Board of Animal Health, we traditionally in our agency work more with producers than we do packers, but it doesn't mean that we're not connected to packers. We just take a different route of connecting with them and working with them on a day-to-day basis or when foreign animal disease comes along. The majority of the time we do spend obviously focusing with veterinarians in the state, with livestock veterinarians and producers, and where the Board of Animal Health mainly focuses is pre-packing plants. Our main objective is to make sure those animals are healthy on the farm and throughout their lifespan before they are taken to market. So with that, you can kind of see in this little chart here on the slide, we do have a relation to the packing plant through our connections with industry and the federal partners at the Food Safety Inspection Service, or FSIS. One of the ways that in Minnesota we started talking about ASF and planning for how do you connect better with everyone involved in the industry, we looked to our poultry industry here in the state. The poultry industry had created a group called the Emergency Disease Management Committee, which the main focus of that group was to make those connections within the state with those different groups that are involved in the industry. So we took that model and brought it into the swine world. And through the University of Minnesota Extension, there were some great experts there, and a lot of my coworkers did a lot of work on this. I can't take any of the credit. I'm just part of a communications subcommittee in the group. But they brought together a lot of those internal stakeholders to form this advisory group. And what this Emergency Disease Management Committee advisory group does is they bring their voices to us to let us know what their needs are and what their concerns are within the industry for when an animal disease event does come along and how we can best respond to that event together. Membership in that group does come from pork producers, processors, different government entities, our University of Minnesota, and importantly, veterinarians in the state. So with that group, as I mentioned, what we like to do is plan ahead. It's very important for us to do this planning ahead because you get all of your important preparation work for a disease emergency done ahead of time. And by doing that, it makes things flow much smoother when an actual event does happen. Because it's really important that you're establishing those relationships beforehand, that you know who those counterparts are at other agencies or organizations. So you have those handshakes done, you have those face-to-face interactions done, and you know who you're going to be working with. Because in a disease emergency event, there's not really a good time to get up to speed and get those introductions done. Those are something that you should really have established ahead of time before an event. So we established that through, again, going back to that Emergency Disease Management Committee. We have a subcommittee on that group for communications, and within that, I work with other communicators from industry, from the producers, from the plants, all those different groups that I had mentioned that were part of the EDMC. I have contacts within those in our communications roles so that we can talk about things ahead of time and how we're going to communicate and respond to a disease event as it unfolds. We're going to share our talking points ahead of time. We have working drafts with one another. We discuss our response plans. So as the government, those entities who aren't in the direct response know exactly which steps we're going to be taking and when. And then we review kind of current events on what's happening globally. We touch base often and talk about where is ASF today, where are some of the risks around the world, and what should we be focusing on right now. So all of this planning, of course, brings us to the point of what happens when something does pop up. How this works for us is that foreign animal disease symptoms are reported to the Board of Animal Health. So in Minnesota, they would contact our agency, one of our senior veterinarians, and once they give him a call, it could be a packing plant, a producer. For this situation, let's say it's a packing plant. They'll call up our senior veterinarian. He'll take the call, and he'll say, okay, we have these symptoms that are being reported. I'm going to send out a foreign animal disease diagnostician who is either a member of the state or the federal government in Minnesota that's going to show up to the facility and examine the animal, collect samples. They're specifically trained to look for foreign animal diseases and what those might look like, and then they're going to move ahead with that investigation. Meanwhile, on the communications front, they're letting me know that, hey, we're heading out to this packing plant. We're going to go look at a foreign animal disease investigation. Someone reported vesicles on a pig. Here's what we know so far. Here's our plan of attack, so that I can then start preparing my communications internally on who we need to alert based on what these symptoms might look like, what the clinical signs are, and what their suspicion is of it being something that's pretty serious. Here's an example of something that they might show up to the plant and see is a vesicle on a pig snout. And then what they're going to do is they're going to collect those samples. Once at the site, will get more details on the situation. They'll get that hands-on and inspection of the animal to get a better idea of, is this something that we might be looking at, a foreign animal disease? And then they're going to take those samples and simultaneously send a sample to our veterinary diagnostic laboratory here in the Twin Cities in Minnesota, and another sample off to the federal foreign animal disease diagnostic laboratory for confirmatory testing. So while those samples are either in the air, in the car, on their way to the laboratory, what's happening internally communications-wise is we're preparing for either one of two channels. We're either preparing for if it's a negative and standing down, or if it's a non-negative and where do we go from there. So making the assumption that it's a non-negative, what we're going to do is that we're going to get that notification from our state laboratory, which is, again, as I mentioned at the start of the presentation, not the official confirmation test from the federal government. That's from our state laboratory. So this tells us that it's a laboratory that's found this is non-negative. We probably have something that's a foreign animal disease, or in this case, it could be ASF that they've detected. So now we know that a lab has found something. So this is where we take that path of we need to start ramping things up. We need to start getting the communications going internally to let people know that they need to prepare and how they should be preparing. We do that by our state veterinarian is going to reach out to the other counterparts within the state, the Commissioner of Agriculture, our USDA Veterinary Services branch in the state of Minnesota, our governor's office, our agency partners like Minnesota Pork, and then industry stakeholders, which would, again, include other veterinarians within the swine industry and others in the state. Now, this is probably the most challenging part of the communications process, which is really not represented. You can't really represent it well in a slideshow, but the biggest issue here is that trust is a factor, because you're telling all these people that we suspect that we have something here in the state, and if it's something like ASF that hasn't been detected before, that's a very serious implication for the entire industry, and we need to be very careful with how we communicate that information. So what we, as I mentioned in the start of the slideshow, take a lot of effort to do is build trusted relationships ahead of time. So when we're communicating with those people, we know we can trust them to treat that information confidentially, yet at the same time use that information to act. When I'm talking about acting, I mean if we're telling the Minnesota pork producers about it, let's say here in the state, we're trusting that they're going to use that information to start ramping up their internal communications plans for when a positive result comes out, how they're going to talk about it, how they get their producers ready to deal with it, how they get their trade sides of things ready to deal with it. They're kind of getting all of those mechanisms going inside and getting ready for when that result is officially announced. We also talk to plant management. If it is detected, like I had mentioned, at that packing plant, they're going to be letting that plant know that they're likely going to be receiving a quarantine and that they're going to be then creating a larger investigation and shutting things down and looking into where was this possible disease spread, what all is impacted, trace back where that animal came from, try and see if it's something where which farm is this connected to, and move along tracing that disease along that chain to see if they can find out where there might have been other animals that are impacted or there could be other situations that we need to look into. Also at this time, internally, we are preparing to go public with everything. What we're doing is working with industry to push enhanced biosecurity. This is something that we've talked about in our groups trying to do ahead of time, is that it's always a good time to talk biosecurity, so it's not necessarily something that it's suspicious that we found a foreign animal disease if we're saying, hey, ramp up your biosecurity. So it's something that would probably be one of the first messages we want to get out to producers, is checking on their biosecurity, making sure that they're following that biosecurity plan and maybe even considering a heightened response to kind of button things up on their farm to make sure that they're reducing those risks as much as possible. Another thing that we're doing internally is we're calling together a meeting of our Emergency Response Council, which is composed of some higher-level people at specific groups and agencies. That would be the pork producers, swine veterinarians, again, our university, our government partners, and the packing plants. And we're talking through what those next steps are going to be, working out a timeline, getting in touch with the USDA and saying, okay, do you have an idea of when you're going to be getting ready to report those results so that we can line up with your timeline and kind of merge into that communication stream to let people know what is going on and what they can expect in the next steps. So as an overall summary of what we do at the state level, you start with that report where we go out, get samples collected. Our veterinarians are gathering the background information for what's going on with the situation. We have those preliminary results, which are reported at our state laboratory, where they let us know that something is non-negative and we should really start preparing to communicate. And then next we have that confirmed APHIS results that, hey, the federal laboratory found something and they can confirm that it is a foreign animal disease. So this is the point at the end of that where we then hand it back off to the federal government and say, okay, let's coordinate with you guys on when we're going to announce this. The federal government would then take over and we kind of merge into that lane of communications and start working collaboratively with them throughout the process. That is all I had for talking about state-level communications. Again, to summarize, what I really want to reiterate is that it's all about trust at the state level and getting those personal relationships built up ahead of time and knowing who you're going to be working with and communicating with them ahead of time before any sort of foreign animal disease might come around. Thank you.
All right. Hi. Good morning, everyone, and thank you for taking the time to join us on the webinar today. My name is Michael Stepien, and I'm with USDA Animal and Plant Health Inspection Service. Today I'm going to provide an overview of how our communications process works from the presumptive positive through confirmation by our foreign animal disease diagnostic laboratory. Let's see. Our initial response actions will begin during the foreign animal disease investigation conducted by state animal health officials with USDA APHIS veterinary services personnel. Depending upon the situation, states may quarantine premises during the investigation and take other regulatory actions if the investigation is deemed to be high suspicion for ASF. If there is high suspicion for ASF, state and APHIS officials will accelerate the diagnostic plan by rapidly transporting the diagnostic samples to both a National Animal Health Laboratory Network laboratory and our National Veterinary Services Laboratory's Foreign Animal Disease Diagnostic Laboratory on Plum Island. Using an APHIS contracted courier service, samples can arrive on Plum Island as little as 6 to 8 hours from the Midwest. Until our NVSL Foreign Animal Disease Diagnostic Laboratory confirms ASF, APHIS will not officially comment on a suspected foreign animal disease. A positive case of African swine fever will trigger USDA APHIS response activities in support of the state and local response. USDA APHIS concept of operations is a unified state-federal response that will include extensive quarantine and movement controls, determination of the extent of the disease through tracing and surveillance, and activation of our response emergency plans to conduct containment, control, and eradication activities and to effectively communicate actions to all stakeholders, the public, and international community. We have an enormous amount of information related to ASF on the website that you see on the slide, from infographics to response plans. And if you're not familiar with that page, I would definitely recommend that you check it out and see if the information that's on there could be helpful to you. A presumptive positive case of ASF will be a pig sample that tests positive for ASF at one of the 11 National Animal Health Laboratory Network labs that are currently approved by the USDA to perform ASF testing. A confirmed case of ASF will be determined by the National Veterinary Services Laboratory's Foreign Animal Disease Diagnostic Laboratory in Plum Island, New York. It is important to note that the FADDL may confirm ASF detection in the U.S. in as short as 6 to 9 hours after receiving a sample, if a good diagnostic sample is available from pigs with clinical signs of ASF. In some cases or situations, this confirmation may take a little longer. The USDA APHIS and states will begin initial response activities during the foreign animal disease investigation period if there is a high suspicion of ASF, including any presumptive positive detections by National Animal Health Laboratory Network. Any state public notifications, USDA APHIS public notifications, and USDA APHIS notifications to the World Organization of Animal Health, World Organization for Animal Health, or bilateral trading partners will require NVSL Foreign Animal Disease Diagnostic Laboratory confirmation of ASF. Okay, so this timeline could always change depending on the factors on the ground, and we'll do our best to communicate any changes with our partner as they're happening. From 0 to 4 hours, this is when APHIS is going to receive notification of presumptive positive, and there's going to be a lot of coordination internally And eventually what my office, the Legislative and Public Affairs, will begin doing is developing supporting communication materials. Some of this already exists. We have a plan in place, and we're ready to proceed, pretty much immediately. So this will be what happens initially. States and USDA APHIS implement initial movement controls, and LPA updates our rollout plan. So our rollout plan, like I mentioned, that's going to include a press release and all the actions that we're going to take to inform everyone of what's going on. And then we'll clear all that through our leadership. Let's see. And so, again, for the 8 to 16 hours, we're going to share that rollout plan. We'll coordinate with the state, allow them to review it, provide their input, and we'll reach out to industry to coordinate. Sometime within the 24 hours, we'll receive official confirmation, and that's when the APHIS response action plans are going to kick into place. We'll activate an APHIS incident coordination group, coordinate public information releases with affected states and industry, and the USDA also communications, and conduct conference calls with different groups in industry. And we'll make public announcements as soon as possible following trade notifications, including posting announcements to the USDA website, sharing information with the Hill, and sending stakeholders information via gov delivery. We'll notify USDS FSIS of the outbreak. If FSIS detects any ASF suspected pigs at slaughter establishment, then ASF and FSIS and APHIS will conduct investigation per existing procedures and protocols as is commonly practiced. Notify CDC of outbreak and coordinate messaging that the event is not a public health threat, and notification of outbreaks sent to the World Organization of Animal Health. Some important notes: if it's ever detected, as I mentioned previously, LPA does have a draft communication plan. This is ready to go, just needs some modification. Just keep in mind that any foreign animal disease confirmed, any lab confirmation of ASF will have significant impact on trade. Any regionalization efforts for trade will take significant time to implement and be adopted by bilateral trading partners. And, LPA activities in my office following confirmation include responding to media, congressional inquiries, national stakeholder inquiries, and potentially initiating national press briefing or routine media briefings or posting to our website. And some concerns, as Michael touched on earlier, APHIS won't mention anything until we have that confirmation, but the states are prepared to coordinate directly with their stakeholders and industry to ensure that everyone's aware of what's going on. And if there's anything going on social media, like I said, we won't confirm anything, but we may make a statement along the lines of, USDA APHIS can't confirm a foreign animal disease investigation is in progress in that state. We can provide more information after we have test results. We do many investigations each year. Most are negative, and APHIS does not discuss investigations until we have results. And so to conclude, again, I appreciate your time today. Please take a look at our website and find information there that could be helpful to you. And there's my email address if you have any questions in the future.
Great, thank you. So as Barbara mentioned, I'm Jackie Matson. I lead communications for the National Pork Board, and I'm going to talk a little bit about the role that a national industry organization like the Pork Board plays in crisis communication. And importantly, I'm going to bring in some lessons learned from COVID, which, although certainly a very unfortunate situation, actually helps us better understand the communication challenges that we might face in an ASF outbreak. So a small silver lining. This is kind of the way we think about responding to a crisis at the Pork Board. Our first order of business, of course, And certainly there are many efforts on the state and national government level as well to prevent a foreign animal disease from ever entering the country or ever becoming an issue, first order of business. But of course preparing, because we can't be naive about the fact that it could happen. So we want to make sure that we're as prepared as possible. And that's not just from a communication standpoint, but also, as Michael mentioned, from a biosecurity standpoint on farms and making sure producers know the steps they can take now to protect their operations. And then, of course, in the instance of an FAD outbreak like African swine fever, certainly responding as quickly as possible. And then nearly, if not more important, recovery for the industry so that we can continue to produce protein for consumers. For those of you who aren't familiar with commodity checkoff organizations, the National Pork Board collects dollars from pork producers across the country to fund industry-wide education, promotion, and research efforts. So in a crisis communication situation, we have two audiences. We are not only working to help pork producers effectively control and respond to the situation on their farm, but we also are working to protect consumer confidence in our products, especially as it relates to industry recovery post-situation. We have to make sure that consumers continue to have confidence in our product and the way our product is produced. So if we think a little bit about what we saw in COVID, and I'll share a little bit of consumer data and then talk to you about some lessons learned. As we go to the next slide, we saw that during COVID, we started some weekly tracking of consumer awareness and concerns related to meat and pork as well as the disease itself. Honestly, when COVID first presented itself, I don't think any of us realized that this human health issue would become such a animal health situation. So it became very important very quickly for us to track and understand what consumer concerns looked like. And the important thing to know is that consumers remained very confident in our products, even as awareness got as high as 78% for meat overall on the impacts of COVID on the meat industry, or 69% for impacts on the pork industry. This data here is from our final wave of the research, which was conducted toward the end of August of this year. And by that point in time, you'll see that awareness down there in the bottom hand side, on the left-hand side of your screen, was quite a bit lower, and that folks were thinking more so about the high prices of their meat as a result of supply chain disruptions. So importantly, consumers weren't concerned about safety, and that was, we needed to know that for our communication efforts so that we weren't breaking into jail by over-communicating about how safe pork was in the midst of this situation when that wasn't really a question that consumers were asking. After hearing about supply chain disruptions, consumers told us that their primary concern was this is the confidence saying strong throughout. This is the both the top two boxes, strongly and somewhat agree that they were confident in consuming pork. This is a really strong score. What we also looked at is separating out the somewhat from the strongly. And when you do that, you have a larger percent of folks who believe somewhat that they were confident. So there's still, although we were very proud and happy that we had that strong confidence in the product, there's something there that we want to continue to focus on and work on as an industry. The next slide is where you see the concerns. So we actually shared with consumers that supply chain disruptions were causing some producers to need to make the tough decision to euthanize their animals. And then we asked them, given that news, what they were most concerned about. And you can see the battery of things that we asked about. We did supply them. This wasn't unaided. We supplied potential concerns and found that the health and safety of employees at the packing plants was the primary concern for consumers. And that's important because what it tells us is that even in the face of some animal health issues associated with COVID, consumers were ultimately concerned about humans and human health. Two things I want you to take away from this is that even though we pushed consumers and provided them with some potential concerns, this is still a relatively small percentage of consumers who said that they had any concern at all, even though the primary one was the health and safety of plant workers. We also did ask about concern from getting COVID from pork, and that was the fifth or so response down the list in terms of top concerns. It's kind of that rust-colored red line that you see at about half the level of concern of the safety of plant workers. So then, not surprisingly, one of the most important messages for consumers to hear, and this might be a little hard to read, but I'll read it for you, that their primary message they said was most important to hear was how important protecting the health and safety of essential workers was at packing plants, and how the agriculture sector as a whole found that to be a top concern as we were navigating the COVID-19 pandemic. You also see that even though contracting COVID from pork wasn't a top concern for consumers, they found it very important to hear reassuring messages trickled in about the fact that there was no evidence from CDC to suggest that COVID-19 could be transmitted through food or food packaging, which is that little bit of validation and reassurance that consumers wanted to be able to hear. So after sharing some of that data, I just wanted to share kind of some communications lessons learned as a result of COVID. And I kind of put them in pro and con columns here, although there's multiple ways to look at all of these. But from somewhat of the pro side, I think that the COVID situation put human health versus animal health in perspective a little bit for consumers. I think in the face of something so significant that they hadn't really seen previously affecting human health and really all aspects of society, suddenly it kind of put in context what was happening with animal health. And we saw actually a great degree of sympathy and understanding for farmers as, you know, fellow humans who were trying to do their best jobs and really facing a lot of struggles. So that was, I think, something that was a real pro. It also highlighted the importance of our food supply chain and drew some awareness to it that we hadn't previously experienced. We're all familiar with how consumers are sort of misguided about what it takes to get food to their plate. And what we saw during COVID is that suddenly it became very clear how complex it was and how important it was to our society, and maybe how much we had taken it for granted. On the pork board side of things, we saw a need for closer tracking of consumer concerns. It gave us an opportunity to evaluate our process and to say, gosh, how can we best communicate with consumers and protect consumer confidence, satisfy our mission, if we don't have a regular way of seeing what consumers are most concerned about so that we can address those. And then, importantly, farmers really shined as effective spokespeople and memorable spokespeople during COVID. We had some questions throughout our tracker series where we asked about who they remembered, respondents remembered hearing from when it came to COVID and pork. And at some points, farmers were the second or third highest recalled spokesperson behind the media themselves and government officials. So consumers were hearing from farmers and felt reassured by farmers in the steps that they were taking on their operation. On the con side of things, we not only highlighted the importance of the food supply chain, but saw truly how little understanding of the supply chain there is. And perhaps it highlighted the greater importance than ever that there be collaboration and coordination among the supply chain in talking about how we get food from the farm to consumers' plates. Also, again, from the pork board side of things, we realized we had a lack of resources talking about public health in the face of these concerns. It has become, and it will continue to be, especially in the instance of an FAD like African swine fever, really important to clarify the difference between something that impacts the animals on farms and what producers are doing to treat and protect their animals versus something that impacts human health. And COVID really blurred those lines and has given rise to a lot of speculation about the interaction between farming and public health. And we just need to be very prepared as an industry to respond to those. Also, from a crisis communication standpoint, as a crisis communication professional, I was reminded that you can't anticipate every crisis. We, as an industry, have put a lot of resources into preparing for African swine fever, but we couldn't have anticipated that this human health crisis of, once in a generation would impact our industry so significantly. So it was just a good reminder that we need to be prepared, but we need to be prepared in a nimble way and have a framework in place that allows us to respond in a lot of different ways based on the situation and what's truly needed. I did want to share quickly, before COVID, we had done some pretty significant, to my previous point, research to understand potential concerns about ASF if it were to be introduced to the U.S. herd. So we had actually, coming into March, conducted 9 different focus groups across a variety of markets and across general population, as well as Spanish-speaking and 1 Asian group speaking English as well, really to get kind of a deep understanding of what might happen in a scenario of ASF in this country and how we could frame our messages to make sure that consumers felt reassured. And then we conducted a pretty significant nationally representative survey throughout March, of course, right as things were ramping up. And we did conduct the survey between the beginning and end of March, so we were able to kind of see if there were any concerns that were increasing as COVID became more prevalent. But of course, we could have had no idea at that point how significant or long-lasting this would be. So I say all that to provide a little bit of caution for how we interpret the results. I think there's some really important lessons that we can still take from this ASF research, and in fact, COVID maybe helped reinforce some of these lessons, but there's also still more work to be done to really understand where mindsets and behaviors are at now post as things hopefully start to resolve. What we found in the ASF focus groups is, perhaps not surprising, people fell into 2 groups. We have the skeptics who believe they can live without pork. They probably would say the same thing about other meats, and they're hyper concerned. So in the instance of something like ASF or really any sniff of anything that might affect their families, they're just going to opt out until they can feel fully reassured that things are taken care of. And that's juxtaposed with pragmatists who they really love their meats and they're trusting of their infrastructure like grocers, and they're more likely to take a pragmatic or measured approach and say, you know what, if it's still available at my grocery store, it's probably safe. It's important to understand these mindsets because honestly, the skeptics aren't as susceptible to our messaging. It's not as easy to help them understand that ASF, for example, doesn't affect humans. They would rather not take any risk, whereas we can make a lot of difference with the pragmatists and also what we call the swing folks. So that gives us some places where we can focus our efforts around consumer confidence. This is just a quick view of how confidence performs as we introduce a ASF scenario and then as we introduce response messaging. So you'll see on the left-hand side of the screen that generally day-to-day, consumers are not concerned about ASF. We have greater than 85% confidence in pork and the safety of pork on a day-to-day basis without being challenged with a scenario of ASF. You'll see that certainly after we introduce a scenario and describe for consumers what that could look like, you see confidence take quite a hit, in fact, cut in half in most cases. And then the good news is that we are able to, with reassuring messaging, recover about 2/3 of the loss in confidence. And what you see there, for the most part, hanging out below the line in the somewhat disagree, strongly disagree in the safety of pork are those skeptics holding out and waiting for final confirmation that everything is in the clear. That was a pretty significant research project, so obviously that's just a glance at some of the data. But here are kind of some takeaways that are important for our industry to be aware of. Consumers are minimally concerned about ASF now, as I mentioned, although I do think given the increased attention on zoonotic diseases that ASF kind of gets pulled in there. Incorrectly, of course, but there's just heightened awareness, again, about the interaction of modern food production and public health. We need to show that ASF can't affect people, but we also need to show action is being taken anyway. So think back at the fact that consumers weren't concerned that COVID could be transmitted through pork, but they wanted to hear that CDC had looked at the topic and had confirmed that they couldn't get it. So even though they want to hear that ASF can't affect people, they also want to hear about what actions are being taken to control the disease. The fact that there's some history with ASF is reassuring to consumers. Also think about this in the context of COVID. Part of the frightening aspect of COVID for consumers is that it's new and there wasn't a lot of knowledge, and it still feels like the common wisdom about it changes day to day. And the fact that we have a long history with ASF, other countries have dealt with it previously and know how to successfully control it. And we have years of data showing that it doesn't jump the species barrier, is reassuring to consumers. Certainly we need to talk about government regulations, although sometimes there's some skepticism about government. Consumers want to hear that government is looking out for their best interests, that they're a significant part of the response, and they really want to hear that everyone is working together for the best interests of the animals and for consumers. And retailers, I mentioned that the pragmatists are ones likely to say, well, if my retailer has it on the shelf, then it must be safe. It's really important for retailers, and we saw this in COVID too. Retailers have a strong power to be able to deliver a message to consumers by virtue of whether a product's on the shelf or what they're telling consumers about how much they can buy, if there's any in-store signage. So this is a really important area where retailers can really reassure consumers by how they handle the situation, the same as they can actually create concern if it's not handled appropriately. Real quickly, just to wrap up with what ASF communications would look like from a pork board standpoint, I do want to quickly talk about what it won't look like. We will not, of course, be communicating at a national level about anything until USDA APHIS has shared their results, and we will only be sharing what they've shared once they've shared it. To the important point that Michael made, the chain of command and decision-making and is really critical to the industry as well as to consumer confidence. So we certainly will do our part to protect that. We also would never be in the business of sharing farm details. This is an ASF situation could spread really quickly, so may not be as relevant as some other situations, but it's really important to protect the identity of our farmers and to speak generally about what farmers are doing across the board. We, of course, aren't sharing market-sensitive information, and we're doing our best to speculate, not speculate. So pretty much your 101 on how to deal with media is our guide to communication. And then basically, as I mentioned at the beginning, our primary focus is producers, and that's in the area of providing on-farm resources and recommendations. and then consumers, targeting them with reassuring messages about pork safety from ASF. And we will, of course, use every channel possible to reach our two primary audiences in the instance of an outbreak. And it's really important to mention that we will be partnering with other industry organizations in our response, because our two audiences are just two areas of audiences. We also have the American Association of Swine Veterinarians, for example, and they have a really critical audience in the veterinarians who are their members. So we'll be working very closely with them. Also would be remiss if I didn't mention the state associations. Michael talked about the Minnesota pork producers and the important relationship that they have at the state level with their pork producers there in Minnesota. And of course, we would work very closely with our state associations, not just because they have those great relationships with their animal health officials at the state level, but also because the needs of producers will differ state to state, especially as we start to talk about depopulation and disposal. What's allowed and what's required is different state to state. And so as a national association, we have to make sure that our communication resources that we provide to producers, working in partnership with the state associations, are relevant to producers in that area. One of the other associations, of course, that we work with is the North American Meat Institute. This is just a quick overview of what NAMI has planned in the instance of an ASF outbreak. But of course, their connection to the packing and processing industry, not just pork related, but across the meat industry, is really critical, and they will be a very important partner of ours as we work to communicate after confirmation of ASF. I know that Tiffany Lee is actually on the line as a speaker as well if there are any questions about NAMI's communication plans in an ASF outbreak scenario. So, Dr. Porter-Spalding, I apologize, that took longer than I expected, but that's what I had to share. I'll turn it back over to you.